and I appreciate you all being here. Thank you. Thanks for coming. Nice to see you. And happy Friday the 13th. This is a happy Friday to you all, and it is another Friday the 13th. I don't want to think about the last one that we had because that was quite a day, but it's nice to be with you all. It's nice to see you all. And we're looking forward to sharing some information with you today and giving you some information on the survey feedback and updating you on just some school-wide information as well. So thank you for being here. And again, I am recording. So if you know anyone who couldn't make it, please know that they will get the recording as well. So thank you for joining us. Thank you for taking the time. And also for those of you who did fill out the survey, thank you very much. We had about 38% of our families reply to that survey. And it's always really helpful to us to hear your feedback. And those that did complete it were very thoughtful and gave us really nice feedback. So we really appreciate that. And what I want to do today is review that survey feedback with you, provide some school updates, as we said. If you have questions as we go through this meeting today, please feel free to utilize that chat box. That's what it's there for. And as we go through some information and as time allows, I'll be happy to address those questions. If we run out of time, I'll still be happy to address those questions. It just might be after the meeting is done. So feel free to utilize that. And I see Sharia and Susan and our Sue Fitzpatrick are all saying hello in there right now, which is fun. But to start with our survey results, one of the first questions that we asked you was, how is your transition going back to school? It was a major shift leaving school and pushing online, and yet another major shift returning. And you provided us with some really, really kind, wonderful feedback. And you shared with us that the transition back has been quite smooth. And for that, we're so glad for you. One of the biggest concerns we had about transitioning back was the drop-off procedure, particularly for toddler families, because we did enforce the drop-off at the curb for the toddler families as well as the rest of the community. And that was a source of some discomfort for some folks, but you did very well dropping your children off, and your children are doing very well. The toddlers did great with drop off, so much so that our toddler teachers are saying, this is what we're going to do forever and ever. It's been so great. So bravo to you for putting on confidence and supporting your children through that. We asked you some things about what's going well for you and where are some challenge points and some concerns. So I'm going to lay out some common threads that were detailed in the survey, starting with what's going well. You all are really happy your kids are in school, and so are we. And the kids are happy too. And so thank you for sharing that. And we're glad to hear that your children are happy to be back at school, and you are happy to have them back here with us. You've said that you feel that the school's COVID prevention measures are going well. So we appreciate that. That is something that we continue to participate in all sorts of ways to get information on the changing regulations and latest science and updates with that. So it is something that we continuously are talking about here. And we appreciate your confidence in that. Many of you said your children are really happy to be back, and that you're having wonderful communication with your children's teachers. And that was really an important piece this year. We hate that you can't come in. We really do. We would love to see you in the school and at the doorways and be able to hug you and shake your hands again. That's the kind of school we are. And so it's very difficult for us too. But we appreciate your understanding and the importance of that right now. It won't be forever. But in the meantime, communication regularly between you and your child's teacher is very important. If you are feeling that you need more, let your teacher know and they'll be happy to feed you more information. But I'm glad you feel it's going well right now. Several of you also said that the format of Zooming is allowing you to participate more actively than before. Sometimes it's hard to physically get away from work and make it over to the school and be here physically, but Zooming has allowed some flexibility with that. So I'm glad it's opened some doors to some people. That's great. I am outside, so if you hear the parking lot and that car beeping, I apologize. Some challenge points and some concerns. One thing that echoed through was finding it challenging to meet other parents and connecting with other families. And yeah, that's absolutely a challenge point when you can't come in and be physically present with other folks. And again, we appreciate your understanding in this, and we're really sorry that you can't come in. And because of this, it does make it difficult to meet and connect with other families, and we miss seeing you too. But I do encourage you, in the meantime, Miss Sue is on this call with us, and those parents that are participating in Parent Perks are finding a way to connect with one another. And so I do suggest using that as an outlet and an avenue to connect with other DHMC families, but it is also open to our 2 other schools. So it gives you a chance to meet families from other schools as well, and even open up your network that much larger. So hopefully in the meantime, that can serve as filling that void a little bit for you. Many of you talked about the difficulty in the sacrifices that you're making so that your children can attend school. This is very, very real, and I appreciate your sharing this. You are all making sacrifices so that your children can attend school face to face, and for you that means you're probably missing out on extended family and other socialization that you're missing in your life. And it is a sacrifice right now, and that is difficult, and we hear you and we understand. Our staff is also doing that as well, because our goal first and foremost is keeping everybody safe and well, but it doesn't mean that it's not difficult, and we understand that. So thank you for expressing that. Many of you discussed your concern about the rising number of COVID cases. It is concerning, and we are monitoring this on a local and state and national level so that we can make sure that we are staying updated with the latest information. As new information comes our way and new protocols and procedures for students, teachers, or the school, we're working hard to keep you as informed and up to date in a timely fashion. So other folks said that you're really missing the in-person school celebrations. You know, this is that time of year where Halloween is a big deal with those younger kids, and Thanksgiving is always a really beautiful thing that happens here at school, and you're missing coming in to be part of that. And we understand. We really do understand. We're saddened by it as well, but we are trying to keep as creative as possible to keep you looped in, but we are keeping in mind safety first. So our goal is to keep our traditions alive and to keep joy for the children while they're here. And we really look forward to a time where we can all come back together and gather like we have in the past. The next portion of the survey, oh, and I'm going to stop here right now. Laura says to the group, we're open to suggestions or ideas for parents if you have them to feel safe, like you can safely connect with one another. So we're happy to have that feedback as well too. So thank you for that. The next portion of the survey asked, what questions do you have for us? What questions do you have for your child's teacher? What questions do you have for the office? And so I'm going to go through the questions that came our way. The number one question was, what might lead us to a shutdown? And so we'll talk about this for a minute. One of the things would be a state mandated shutdown, like happened before, although it would look a little different this time. We are able to keep our early childhood open. So children 18 months through kindergarten through 5 years old can stay face-to-face under regulations. Grades 1 through 8 would push virtually if this was a governmental mandated shutdown. Other things that might force us for a temporary closure could be a quarantine type of situation. For example, if there was a positive case within in our community, in our classroom, or sorry, I'm letting people in at the same time. So a positive case in the classroom might lead to a classroom quarantine for a period of time. Depending on how we trace and track that, it could lead to a multi-classroom shutdown, or it could lead to a temporary 2-week quarantine for the school. So those are situations that could lead us in that direction. At this point, we are not electing to go virtual. But those are situations that are laid out that we are prepared for in the event that we have to move that direction. Another question that came up was, when do I know if I should keep my child home? And this is tricky right now. Our advice to you, and I have to tell you, our parents have been unbelievably respectful and supportive and cautious. And we're really grateful to you for that. And for your diligence and your community mindedness in this. Our advice is, if your child has a new symptom that is unrelated to a documented pre-existing condition, asthma, documented allergies, that type of thing, it's probably best to err on the side of caution and have them stay home and watch the symptoms. If your child is an elementary or middle school aged child, they might want to take advantage of Zooming in for the day and see how they feel. If they're mild, if they're feeling well enough to participate from home, then our elementary and middle school aged children would be welcome to do so. And we have had a couple of students choose to do that. But I want you to know it's okay to have a sick day too. If you're not feeling well, it's okay to just focus on feeling better. So that's our advice on that part. And you have that symptom checker in the morning that you're filling out for us through the Google form. If you have some symptoms that are unrelated to a documented pre-existing condition, probably best to err on the side of caution and watch for a little bit. Certainly, if your child is going to stay home, please let the school know. We appreciate knowing those absences, and we can follow up with you and check on you as well. Another question that came our way was, could it be an option to switch to virtual? And yes, we offered an option when we issued re-enrollment. If you are feeling like sliding back to virtual for your family is the safest and best choice, and you are grades 1st grade through 8th grade, we can have that conversation. You would need to let your child's teacher know and let the office know so we can take the appropriate measures to make it a permanent thing rather than just a one-day Zoom in for sickness. We would want to make sure that you're prepared at home to do so. So you would let us know if that is your plan. Another question, and this came from you, Annette, I'm happy to see you, about Iowa testing. We do the Iowa assessments every spring, and last year, the world shifted on us, so we didn't get a chance to do our Iowa assessments. So the plan is that we will be doing them this spring. We are shifting them to online. The children will be participating on the computer online doing the Iowa assessments this spring. We plan to conduct a full battery in the spring as usual. However, our plan, instead of starting at 3rd grade and up, we are going to bring it down to 1st grade. So we get some more data from those younger children this year. So we'll begin 1st grade through 8th grade, doing it online this year. In addition, we've added a second measure to the Iowa. We are going to be using an adaptive testing measure, also through the Iowa assessments, but it's called the Iowa Flex. And it's an adaptive assessment that we will be using as a benchmarking tool for our students soon. So we get some data earlier in the year, and then we'll get some data in the spring. And again, that Iowa Flex will be utilized for grades 1 through 8. Another question was about hot lunch. When's it coming? We miss it. I heard that from a lot of folks. I also miss it. I love hot lunch, and I really don't like packing lunches. So our middle school students are still running this program as part of their economics studies. It just has had to really shift differently. Safety in mind, we had to talk about serving in a different way. We had to talk about ordering in a different way to keep our safety measures and regulations as stringent as possible. So the students are working with local restaurants like we have in the past, but we have shifted. So the menu is going to look a little different. We've got some new additions this year. And we're working with local restaurants who will individually plate per child and who will deliver to the school. Oftentimes we would get things in banquet style, and the students and staff themselves would serve up the children. We are not doing that this year. Every child will have their own individual plated hot lunch. We are expected to launch this in December. So please be patient, it's coming, and payment will be electronic. No more filling out that paper and writing a check and bringing it in. You'll be able to do it electronically, very similarly to the way that the Reason Poinsettias order came out to you, and it'll be through PayPal. So you'll have that to look forward to. Some of the updates since we last met. We had a professional development day. And on that day, we focused on a few things. Many of you joined your child's teacher for a classroom curricular Zoom. So again, if you didn't get a chance to participate in that live, you should have received a recording. If you didn't, just reach out to your child's teacher. They all recorded those sessions for you. So that was a portion of the day. The other part of the day, we focused on retraining and learning new pieces of our tracking system for our curriculum called Montessori Compass. And then the largest part of the day was spent with updating preparedness plans for virtual learning, just to be prepared. Our teachers spent time working on some rich experiences, improving how last spring went based on your feedback that you gave to us through surveys that we had conducted before. And every level is prepared to switch into a virtual realm if that need arises. So preparedness of that. We are proud to say and happy to say that we have had no COVID cases in our building. We have had no students, we have had no staff, and we are proud to say that we have had no COVID cases in our building and in our community right now. We are taking every mitigation effort necessary and then some to prevent as much as we can. You at home are making extreme sacrifices to do the same, and are keeping in mind your actions at home translate and have an effect to what's happening here at school. So thank you so much for your consciousness and diligence to that. It has certainly helped us all stay safe and healthy. You did receive a letter this week sharing information with you about a situation where a student had an exposure. This was a situation where the student became exposed over a weekend. We ended up having that professional development day on Friday. So that gave us some buffer time as we consulted with all sorts of agencies on the best practice and most conservative measures we could take to keep everyone safe. So students and staff had several days of safe space between when that particular child was last in school and when the household member became symptomatic. Once the family contacted us immediately, we are grateful to them for contacting us right away and their openness and honesty. And after they shared with us their news at home, we got on the phone with the CDC, the Michigan Department of Health and Human Services, MIOSHA, the Wayne County Health Department, and conducted some calls with several on-call medical staff for guidance to make sure that we were taking every precaution in place. They were all really impressed at the sanitization measures that we had in place. So I felt really good about that. The second that they heard that we had an electrostatic machine that we were using daily, they felt really, really good about that. So we got some props for that, which felt really good. But these agencies continue to guide us as we learn more and more about this disease and mitigation measures. So we will continue to keep you informed and provide guidance to you when necessary for guidance. But as we receive new information, we will continue to be open and transparent with you about that. So it served to inform you. This is the information we know. And we're sharing it with you so that you know it as well. And we continue to look forward to that transparency from school to home as well. And because of that, I really want to thank you for your trust and your partnership. It's taking a lot of trust and confidence in us for you to share your children with us every day. And we are so grateful, and we do not take that responsibility lightly. And we want you to know how much that we respect and value that partnership with you. If you have any questions, you are welcome to type in the chat box. You are always welcome to reach out to us, give us a call, give us an email. Ask for a Zoom setup. We can talk face to face and see each other live if you'd like to do that. Please don't hesitate to reach out and connect with us. We're hungry to see you too. We miss you being in the building. So we're happy to connect with you, and we're happy to help you with any concerns that you have throughout this time. So if there's any questions and you want to put them in the chat box, I'll wait a few moments. If not, and you need to get back to work or Zoom back with your coworkers, you're welcome to sign off. Mona, thank you. I'm glad you joined us today. Thank you so much. It's nice to see you. Have a good day to you too, Beatrice. Nice to see ya. Have a good day, Amy. Thanks for joining us. Thanks, Paul. Us too. That's our plan. That's our plan. Thanks, Sharia. Nice to see you. Thanks for coming.